Hey, everybody. Welcome back to Five Boys in a Business podcast, where we talk about our family, the business, and the many shenanigans involved. You can catch the podcast every Monday around 10:30ish live on Facebook, or, of course, you can tune into any of the podcast channels. Also, be sure to check out the merch store, asvcmerch.com. asvcmerch.com, that's correct. I haven't said it for 2 weeks now, so I feel like I'm messing it up. Where you can find our long sleeve comfy shirts and some other gear. Now we've added some onesies, which you might want to know about. Oh, wow. And our stocking hats. So, yeah, we have a special guest here. You want to introduce him?
Yes, Dr. Richard Keller is a reliable and diligent pediatrician. He looks after the little ones of Cicero, Indiana. He currently practices at IU Health Physicians and treats children in ways that help them relax and cooperate. Dr. Keller received his bachelor's degree from Indiana University Bloomington, followed by his medical degree from Indiana University. Furthermore, he completed a residency in pediatrics at the Riley Hospital for Children and is certified by the American Board of Pediatrics. He is also an active member of the American Academy of Pediatrics. Dr. Keller is passionate about promoting wellness from birth to adolescence, and he works incessantly to provide quality care for his patients and their families. His extensive knowledge base and exceptional clinical experience in pediatrics ensures that kids receive the best quality care. Welcome, Dr. Keller.
Thank you. Thanks for having me.
Yeah, we're glad you're here. I know Richard from growing up with Holden, our kids growing up together. Holden and Johnny, really, with your two kids,
yeah.
Daniel and Bridget. And so I know that you were going through some transitions with work and like starting some new things, and I was like, hey, he'd be a perfect guest.
Yeah, well, thanks.
To have on. So tell us a little bit about where you grew up and things like that.
Well, I grew up in Peru, Indiana, which is an hour north of Indianapolis, kind of between Indianapolis and South Bend, and it's a small Indiana town.
Right.
It was great growing up there. I was able to play basketball, tennis, baseball, all the way through 3 sports, and nice small town. And I worked there actually for 18 years after residency, and I just took a job here in Cicero about 5 months ago. So, yeah.
And so where'd you go to school?
I went to IU and Bloomington. I was majored in biochemistry for 4 years in Bloomington, then went to IU School of Medicine in Indianapolis for 4 more years, and then I did my residency at Riley for 3 more years. So I was an IU guy all the way through.
Oh, yeah, exactly.
Still
all
am.
IU.
Yeah, now I work for IU. So yeah.
Yeah, exactly. So with the transition that you've just made from, working in Peru, right? You were saying for 18 years.
18 years. Yeah.
So what made you do the jump over?
Well, in Peru, it's a small hospital, and the pediatricians still go to all the deliveries for babies.
Okay.
So I was on call all the time in Peru. So I lived here in Noblesville, and I drove to Peru an hour each way, and I just spent the night up there every 4th night. So every Wednesday night I spent the night in Peru. Every 4th weekend I spent the whole weekend in Peru. So I did that from the time 2001 to just this past summer. And as the kids were growing up, I missed a lot. I missed a lot of Daniel's basketball. I missed a lot of Bridget's swimming, and I just missed a lot of the growing up. So finally I had 2 years left with Daniel before going to college, and I just decided I needed to be home more. And an opportunity came up with IU Health here in Cicero, and I just, I took it. And I miss being in Peru. I miss working there. It was a great place to work, and I knew everyone in town. I took care of a lot of my friends' kids, grandkids, and I do miss that aspect of it. But my job is great here. I love it, and I'm not on call anymore. So
there
that's
you
the
go.
biggest thing. So it's just hard being away from the family.
Oh,
and,
sure.
When you get your kids, obviously you've had your kids at the same point in life, and just watching them getting ready to leave, I couldn't miss the next couple years of Daniel. It's the first year I've ever not missed a basketball game.
Yeah.
So I saw every game he played, every minute he played this year I saw. So,
that's really cool.
So that's good. I just used to miss a lot of his games, but now it's good. I just need to get busy now.
Yeah.
It's just got to build a practice, starting over from scratch. So.
Got it.
Yeah.
So how does that work when you start a practice? You're affiliated with a hospital, but do you do anything independently to try and build the practice, or is that all external within the other hospital?
Well, IU Health has all their marketing, which
Right.
is great, and they're doing a good job. And there should be a new campaign coming out on Facebook, and some billboards and other stuff. They're going to another round of that. A lot of it for me is just word of mouth. I'm
Sure.
just getting out, trying to meet people,
Right.
and going, just like this, getting great, word of mouth through stuff like Facebook and
Right.
just going out in the community to different festivals, and the summer will be big as far as doing that. Trying to get to the Cicero Festival,
Right.
You know, some of the like the farmers markets on weekends and that. And the other thing I just try to do is just give great patient care, be accessible, and if you do that, word of mouth spreads. You know.
Right.
Right.
How long do they say that it usually takes for you to like develop a?
I don't know. No
No one knows.
no one really knows, because this is a brand new practice from scratch. So I had zero patients. You know.
Zero patients.
I started with 0 in August. I'm up to probably 250 patients now. So it's slowly growing. So hopefully within a couple years we'll get there to the point where I'm full every day. Right now I'm seeing 3 or 4 patients a day. When I was in Peru, I was seeing 25 to 35 every day.
Right.
So there's plenty of room for patients, and the great thing is we're very accessible. We get patients in immediately. If you call,
boom,
we'll get you in immediately.
Literally. That's funny.
Within
you say
5
that.
minutes.
Right. Within 5 minutes.
We'll
just
say,
come over.
Come over. Yeah.
Are you at the front door? Come on in.
Yeah, exactly. I was talking to my mom about that this past weekend, about how we were laughing about that new doctors, and certainly because of your level of experience, you're not new from school.
Yeah.
But that people are always hesitant to schedule. And what she was saying is actually, those are the people you want to schedule with because they have time for you.
Yeah,
and they can spend time with you.
Oh,
and they're not
definitely.
in a rush in terms of their slots and
Yeah.
everything like that. And so I was like, yeah, that's a really interesting way to think about it. I never thought about it that way. I do here at the clinic because I'm always like, you really want to see the new associate. They've got time to spend with you, and and so it's just fascinating that some people, they just don't, we just don't understand that or get that or appreciate it, I guess.
Right.
Yeah, well, that's one thing that is great about new practice. I can spend as much time as I want with every patient. Like, in Peru, I was doing 15-minute well child exams, and that's a short time to get through everything you need to get through. So I was rushed. I definitely was rushed. But now I can spend an hour. I spend an hour and a half with with the well child. Just hanging out, talking, chatting, getting to know the kid, and it's just so nice to not be rushed.
Oh yes.
And I think the parents appreciate that they can come in and they know they're going to get as much time as they need.
Right.
Which unfortunately during the busy time of year, a lot of practices you don't get that.
Right.
You just don't have doctors just don't have the time. And
right.
So yeah, I think it's kind of showed me I really love practicing pediatrics. When I was in Peru, I was very busy, and I think I got burnt out on it. When you're seeing that many patients a day, it's tiring.
Yeah.
And now I can, now I'm rejuvenated and I realize, this is what I love to do.
Right.
And it's fun again.
That's really cool. So in Peru, when you then had to be there for every baby that's born, or somebody does,
well, that'd be nearby. Right? So we didn't have to we didn't go to every delivery, but we needed to be nearby in case there was a problem. So they would call us if they were expecting a problem. We'd have to be at the bedside.
Right.
If it was a normal delivery and they weren't expecting us or expecting a problem, we wouldn't have to be there, but we'd have to be able to get there in 10 minutes.
And that's because they did not have anybody that could manage the problem.
No, the nurses could and the OB could for a short time.
Right.
But yeah, if that, we need to be. I never felt comfortable being more than 10 minutes away from the hospital.
Wow. Yeah.
Because if a baby came out not breathing, I needed to get there immediately. So we had to be nearby all the time. And my partner in Peru, Dr. Neil Stalker, he's been there for 40 years. He lived 10 minutes away, so he could be at home on call and be fine.
Boom.
But when I was on call, I had to either stay in the hospital or get a hotel room.
Right.
Which is hard to live in a hotel a quarter of your nights of your life.
Right.
Right.
That gets old. Absolutely. Yeah.
So what was it about pediatrics that made you choose that particular
How did
discipline?
I choose peds? I always thought I'd be a family doctor.
Okay.
I don't know how I decided to be a doctor. I don't remember making that decision. I think I was always a good student. I was always good at sciences, and I went to med school. I went to IU, and I think, okay, I'll be a pre-med student. And it just worked out, and I made it in med school. And so I never really had a plan, I guess, going in what I was going to do. But when I started med school, I thought I'd be a family doctor. That was back in the time they were really pushing primary care. I think they still are. But back then, when I was starting med school, they really pushed primary care. And when I started med school, the state of Indiana had a program that if you went into primary care, they'd pay for your tuition.
Oh, that's cool.
So I took that scholarship.
Yeah.
Before my freshman year, they paid for my tuition all the way through. So I was basically, it's going to be family practice, pediatrics, or internal medicine were the 3 options I had. So that kind of made that decision for me. So I always thought I'd do family practice. And then I went to, you go do your rotations your 3rd year where you do internal medicine, family practice, pediatrics, all of them. And I realized I didn't like adult medicine. I didn't like kind of the chronic problems.
Right.
It seems like they weren't really, curing anything.
Right.
You treat the
You're just
hypertension,
managing
the
things.
diabetes. You're managing chronic illnesses. Whereas in kids, I've found out it's all, acute problem. For the most part, acute problems. So ear infections, vomiting. Most of what we do is acute issues that you make better.
Right.
Which I really like that, where you can make a difference. You can cure the kid of their ear infection or whatever the case may be. And then so basically what we do in peds is we take care of well children and we take care of acute issues. Obviously there are chronic problems we take care of, but most of what we do is that. And I just realized I like being able to cure things, and also I just like taking care of kids. Kids are fun.
Yeah.
They're
probably very unpredictable.
Yeah, they are, and they're funny too. And kids are, you get 5-6-year-old kids come in, and they're going to say something funny. They're going to make you laugh. They're just fun to hang out with. I guess I didn't really like adult medicine, but I loved the pediatrics. I just loved being around the kids and being able to take care of them. And it's just different. It's a different set of problems we deal with, but that are much more, I think, manageable. And just it's nice to be able to make kids feel better.
Sure.
And that's kind of what led me there. So
that's awesome.
Yeah, I think you can definitely probably feel the impact that you have on the family.
Oh, yeah.
Do you know what I mean? And so, we a lot of times equate ourselves to pediatricians because in the beginning your patients don't talk.
Oh, yeah, exactly. Yeah.
And so it's
you
very
gotta figure
similar.
It out
you got to figure it out.
Without them being able to tell you what's wrong.
Right.
Which,
you have to go through the
parents.
parents.
The parents one, yeah.
So
what we do is very similar.
Yeah. And so
as far as trying to, when they can't tell you what hurts, you got to, figure it out. And,
I find it fascinating. And then some histories where when people come in where they can almost lead you down a different path.
Oh,
and you're like, oh, wait, that's what they're telling me. That's not really what I see going on.
Exactly,
you know what I mean? Kind of a thing. And how I love the problem solving aspect, of trying to figure that out.
Yeah.
And so it's very similar.
Yeah. That's just, taking the history is the biggest part of what we do. Probably you too, obviously, just being able to problem solve that. And that's where I think things is interesting with the internet now, how, I don't know if you see that, but just how parents come in with a better idea of what's going on because they have looked it up, they've Googled it, and all that. Sometimes they're wrong,
right?
But a lot of times they're not. The parents a lot of times they'll come in and say, and a lot of times they'll say, well, I know I shouldn't do this, but I Googled it.
Oh, what everybody says.
I'm like, well, no, Google's great. You just got to know what source you're looking at. If you're looking at a reliable source, it can be wonderful. But a lot of times parents come in with the diagnosis in hand,
right?
And they're right sometimes.
Yeah.
But I think, just in general, there's so much more information out there now in medicine. And I'm sure, in what you do, there's just, I use Google all the time.
Oh, yeah.
In the office. Like,
yeah.
I have a whole bunch of books, but I generally just, if I need to learn or know something, I'll Google it and find a good source on the internet. And,
that's how we are too. I mean, we have like what we call a veterinary information network, and there's a couple of them out now. Ven is the most common one, but then there's another one called Ignite, and where you have access to either specialists or people have asked this question before. I always tell like my associates, like, you're not the only one with this question.
Yeah.
So go look it up on Ven because there'll be somebody who's asked a similar question or has a similar case, or and just having access nowadays to all of that information makes it so much easier to practice medicine than
it is,
me being in my box as a solitary practitioner in the beginning and like, I'll go look it up in my book. Well, my book might be 10 years old, or what are new things that people are doing to solve problems, and creative thinking that occurs that maybe I haven't thought of. And so, I think the internet's a really good thing. We have the same thing where people come in and say, oh, I shouldn't do this, but this is what I think it is, or this is what I figured it is, or, so it's always fun to hash it out with them.
A lot of times parents know more about the problems than I do. I always tell parents with kids have chronic problems, chronic, kind of, rare problems or even, more common problems that they're going to know more about than I do.
Right.
If I have 2 kids with a problem, that parent's going to be an expert on it where I'm not.
Right.
And I always encourage those parents, tell me what you think.
Right.
Just information. It's just exploding how much there is and how much you need to know as a physician. It's just almost impossible to know it all. You just got to know where to find it.
Exactly. I say that all the time. Don't I say that all the time? I say that all the time. I'm like, I'm not the smartest person, but I know where to find information.
Stuff. Yeah.
Exactly. And so I think that there's solace in that, comfort in knowing that, okay, I can figure this out.
Yeah, exactly. Yeah. Critical thinking, knowing where to find information, knowing how to process that information and figure out what's good information versus bad information.
Right.
But yes, medicine's changed so much from when I started, and when we both started, that it seemed like at the time when I was in med school, just memorization was everything.
Right.
Like we had to just memorize. Where I think probably now it's just more critical thinking is more important.
Right.
And
there's a lot of curriculum that do like problem solving curriculum where rather than learning actually like textbook learning, they're problem solving learning, like so they're learning conditions via problem solving techniques.
So I was always good at problem solving. I was not a great memorizer, so I really struggled in med school. Just those didactic, just the anatomy. I wasn't great at anatomy because I'm just not great at just memorizing. I was good at figuring stuff out, and solving problems. But once I got to med school, it was hard. I'm just not that smart to memorize that much. Where some people could.
Oh yeah, there's some people who've got photographic memories. What do you think are some of the challenges? One of the things that our kids always did together were sports. With kids growing up in today's world, what's your view on like year-round sports? Or
that's tough.
What are you seeing, like chronic issues or more common problems maybe than historically?
Well, definitely seeing overuse injuries. Mm-hmm. When I was a kid, probably when you were a kid, we did different sports every season. Mm-hmm. I played baseball in the spring, and I wouldn't touch a baseball. Once it was over in August, I wouldn't touch a baseball until February. Right. My dad was a baseball coach, so we had access to batting cages all the time, but we never did it because once baseball was over, I'd start playing tennis.
Something else.
Yeah, so I had tennis start. We'd play tennis all summer, all fall, and then tennis was over, we played basketball.
Right.
So it was like every season was different. During the summer we'd shoot around with basketball, but I wasn't playing every day. But it was definitely a different. Whatever season it was is what we played. Whereas now it's like you said, year round, and they're training year round, and definitely injuries. Like baseball pitchers, we're seeing they're throwing all winter, so they're ending up with elbow injuries, shoulder injuries. Whatever the sport is, there's always overuse injuries. Mm-hmm. It's just tough, especially where we live here. It's hard to be more than a one-sport athlete and be able to play in high school. Like my son Daniel, he's a pretty good basketball player, and he's a lot better than I was. Mm-hmm. I played varsity. I was the most valuable player my senior year in Peru. But he's much better than I was, and he's playing JV here. At Guerin Catholic, he's on the JV as a junior, but just skill-wise, he's so much better than I was. But he's been, playing year-round basketball since third grade, probably. He's done track and played a little lacrosse and cross country, but his main sport's been basketball for the last 9 years, and he, it's just a different world we live in, and it's so competitive. And the question is, how much is that necessary? I don't know.
Right.
I think the more sports you can play, the better off you're going to be in the long run. But I think there's so much pressure on kids to pick a sport at a young age, and I think that's all from the coaches and from the parents.
Right.
Yeah.
And
I see that even with the pressure, with the high school kids, like say Holden, for instance. When freshman year, his track coaches were like, "It's fine for you to play, basketball, but next year." During summer, you're going to have to pick which one. And I'm like, well, that's kind of a load of crap, because, why does he have to, if he's decent at one, why are you making him pick something over another thing, and so I think that that's happening to some degree without them saying that it's happening.
Well, everybody encourages the kids to play more than one sport, but they don't really allow it to happen.
I think the specialization is tough because you look at kids like that have played baseball. Like our nephew's played baseball since he was little, year-round baseball, and they just have so many more reps than some of the kids who play seasonal sports. Yeah. And I think it becomes so hyper-competitive that maybe the coaches recognize that and say, you probably got to choose if you want to be at this level and compete with these other people who are doing it more than you are. You have to do that.
Well, that's definitely the case. If you're not playing as much as everybody else is in that sport, unless you're just an outstanding athlete, which some people are, or they can do multiple sports just because they're such a good athlete, but.
And I don't think they had. I know for sure when I was growing up, year-round sports just weren't available. Now they are. So some kids gravitate towards that, and just those opportunities are there. Whereas when we were growing up, they weren't. So, and it'd be interesting to, if you could look back and say if those were available, would kids have done it as much as they do today? You know what I mean?
Yeah. So did you grow up in a small town, or were you?
Yeah, pretty small.
Okay.
Well, I grew up in Knoxville. So
Okay.
I mean, I went to high school in Knoxville. The other, I was in a smaller town about 30 miles west. Kind of similar to probably Westville, wouldn't you say?
Yeah.
Okay.
Yeah.
So I mean, it wasn't small, but it was pretty small. And I mean, there was no year-round anything.
Yeah.
There may be in high school. There might have been. I think it was even after high school. I mean, if you were running, let me back up. If you wanted to run, there was always a 5K or something that you could go do. But as far as like travel soccer or travel, that was unheard of.
Yeah. Well, when I grew up, Peru was the same way. Again, we never had.
There were no field houses.
Yeah, there was
Yeah.
nothing like that. Yeah.
There was
rec centers.
no
That was it.
access to
Yeah.
field houses or anything. We had to break into gyms to be able to play in them.
Yeah.
Like, after hours, or our
Break
coach.
in.
Well, like our coach
Find an
would have
open
to
door,
like
yeah.
be like, "Here's the key, but I didn't give it to
Oh,
you,"
right,
kind of a
right.
thing,
Yeah.
And so, we would search for places to play.
So did you play organized basketball in the summer?
Yeah,
at
we
all?
would play like.
Like, did you have an AAU down?
Yeah, once I was in high school, we had AAU.
You did,
My
okay.
senior year of high school, we had AAU basketball that I played on. That we went to like the national,
Okay.
tournament or whatever. But before that, we might have done like White River games, like
Okay,
where we played,
yeah.
It's not like it is now.
Right.
I mean, it's not.
So even here in Carmel, it was that way
Yeah.
back in the 90s or 80s.
I mean, yeah. So I played 3 sports. You could play 3 sports in high school. It
All
wasn't-
3 did?
Not all every single year, because I chose basketball over cross country.
Right.
Junior and senior year. Because we were good at cross country. We went all the way into November.
Yeah.
And I was like, I want to start focusing on that.
Right.
So do you feel as good as you were? Could you do that now at Carmel?
Could I have done?
Could you
could I
still
do it
do?
now?
Could you still do multiple sports and play basketball at Carmel?
Now?
In this time of year, or this age in
I don't
2020.
know. I mean, it depends. I think that I have no idea.
I doubt it.
Yeah, I don't
I
think
doubt it.
that. I think that somebody would have made me pick, probably.
I think as competitive as
I could have
the
done
place at
basketball and
Carmel.
track, because basketball was behind track, is in front of track.
Right.
So I probably would have done
Could've
those
still
2
done the
sports
same.
over and over and over again. But I mean, now cross country, they're not. They've got so many athletes. They don't need.
Yeah.
They don't need runners. Whereas back then, they were all encouraging us all as 8th graders to run as freshmen. So.
But if you were playing now, probably as soon as basketball was over, you'd be doing AAU basketball, and you'd be traveling the country.
Yeah.
I just think those kids. I mean, I remember going to the AU tournaments with Harrison at the 8th grade, and I was like, I don't know how you compete with these kids. I mean, they're just so big, they're so fast, their skill set is so much better than some of these other kids that are competing, and that's, I'm sure, due to reps, and they're year-round training and stuff. And you get to a Carmel or something where you have kids of like skill sets, and you come in and go, I don't want to play, and you're just it's tough. So.
Yeah. Well, the biggest thing I see with youth sports now is just the money aspect of it. It's just a churn. They just keep churning kids through to get
Money.
those tournaments, and they're playing every weekend, and it's just a money grab.
Oh, it is,
That's the biggest thing.
absolutely.
It's not great for the kids, but
No, it's definitely, and I felt like that with Holden, like with where they would encourage you to do this tournament or do this tournament, and it's like we don't belong in this tournament.
Exactly,
We don't-
yeah.
You know what I mean? And
Yeah.
it's like, yeah, I agree. It was completely, about generating revenue,
Yeah.
either for that field house or
Yeah.
for whatever.
Yeah.
The tournaments are interesting. I remember we went to one with Harrison in 8th grade, and I was talking to somebody there about scouts or something. He said, yeah, a lot of these tournaments, that's where the scouts go, because you have you have all kids from all different schools. He's like, they don't necessarily gravitate to the high schools. They'll come here to look at the kids first. And he told a story about how there was chairs all the way around the courts as they played, full of scouts. I mean, looking at the kids as they head into high school and see what's. So I was like, wow. And so I wonder how that may have changed things. Where years ago, you go to the high schools to observe.
yeah, I think basketball,
now.
that's what I know through Daniel, but that's where most of the recruiting is done. There's interesting, like I think it was 7th or 8th grade, they started having recruitable tournaments that Daniel would play in. So they'd always have to sit through this NCAA presentation, and you get to the gym, they'd have half the gym roped off for college coaches, but there'd never be any coaches there. No one's going to come watch my son in 8th grade. He's not.
Right.
So they'd go through all this process, and then there would never be coaches there.
Right.
But definitely, I think all the recruiting's be done at the high or at the AAU level.
When I was talking to my college teammate this past weekend, and she has a son that's playing in at Hampton, is a freshman at Hampton, and she was like, you will never see me in an AAU gym ever again. Okay. And I was, we were laughing about it. I said, yeah, I said, it's a whole thing, isn't it? And she was like, oh my God. She goes, I can't stand AAU basketball. And I was like, and so I was talking to her about it. I was like, why? And this is something that I think we've had a conversation about historically over time. But she was saying that, Billy, say for instance, is playing in a game and he, has a bad game. He's like, I had a bad game. Yeah. I got another game. You got another Sunday. Game. Yeah. And so she's like, I got so tired of watching kids not play hard and play, so, I was like, it devalues the experience because there's always another game. Yeah. There's always another game. And, I felt like that with Harrison where no longer was it like, you're looking forward to a game, that you were just waiting for a game, and so just that, taking it down a notch from the standpoint of excitement, and there'll just be another game. If I play bad, oh well, there's just another game.
Which is funny because I look back at my high school career, I think my whole life, probably I started playing competitively in 5th grade. Through my senior year, I played like 120 games my whole life. Yeah. Like actual games. Right. Where there was a referee and everything. Like, Daniel played that his first 2 years of his, 3rd and 4th grade. He had played more games than I'd played my whole life. Yeah. Now, he's probably played 50 to 60 games a year for, however many years. And, definitely. We got another game.
We got another game.
We got to play again in 2 hours. Yeah. The other thing that's funny is just, all the travel teams that will travel to another state to play the teams that are local. Yeah. Like in Daniel's back, they'll go to Louisville and they'll end up playing teams from Indianapolis, So all these travel is just for the sake of traveling. Yeah. Not to get better competition. It's just.
Yeah. It's absolutely interesting. Yeah. And it's, like you said, it's huge money.
Yeah. It's all a money grab.
It's the teams huge, too. Remember seeing the buses and the banners and they're from Louisville and they have the travel bus and everybody out there, the tent and everything. It's great.
Oh my gosh. So what do you think about telemedicine?
I'm interested in it. I'm setting it up in my practice. Okay. IU Health is trying to promote telemedicine. And I think it's going to be useful for kids for certain things. Okay. Behavior type things, I think it'll be perfect for. I can't examine the kid over the internet. Right. But, a lot of what we do is history. So, I'm looking forward to be able to have it as an option. I think we're going to use it in a smart way.
But I think it's going to be useful. When you talk about behavior, you mean if you have somebody that's anxious to come into the office, or do you mean like watching the child?
Well, just like a lot of times what I do, like say like ADHD is one that would be perfect. So we have a lot of kids with attention problems that they have to come in every 3 months for a visit because we're giving them medicine. Mm-hmm. Well, that's a perfect way we could do it over the internet, do it from home. Or if the kid's just having behavior problems, the parents just wants to talk about the behavior. Well, they probably don't need to come in my office.
They don't need to see you from a physical standpoint.
I don't need to physically or do a physical exam. So if I can just do it over the internet and talk to them, and I can observe the kid behavior over the internet, that'd be great. Mm-hmm. So those type of things I think is perfect. I don't know for you, will you be able? Is that something you guys even look at? Or?
Oh, yeah. To some degree, like they say right now, like we're already practicing telemedicine to some degree because like we use a lot of texting. Somebody might send a picture in, or somebody might send, so it's like, okay, do this, if this doesn't improve, then do this. Yeah. So from that standpoint, I've looked into telemedicine, and there are practices that are using it in veterinary medicine. And there are applications where you can use it, like companies that have like a device where you can use like set up the application to be able to use it, but we can't wrap our heads around the like you can't have your hands on the animal and they have so much fur. It's hard to see things, and so I don't know. I agree with you. I think from like you need to be able to, like, would it apply, for instance, we have patients that have to be examined every 30 days because of DEA law. Like, could you potentially, which is a nuisance for the owner, if you have a cat or a dog, on a controlled substance that requires them to be examined every 30 days, could you implement a telemedicine exam? Would it suffice? You know what I mean? And prevent them from having to come back and forth all the time. So like an application like that, or like behavior. Yeah, that would be, a lot of times especially if I've been historically seeing a patient, I don't need them in front of me to be able to talk to the owner about,
Yeah.
behavior or whatever. Or I can see the pet in its environment.
Exactly. Yeah.
But like a skin condition, like I don't know how I would
Yeah.
even like look. I don't even know what I would
Yeah.
do. Or, my dog has an ear infection. I physically have to be able
You have
to
to look at it. Yeah.
Yeah. And so I think then you say things like, well, okay, it looks like maybe they set up that type of exam, but then you can't do it. So then you're like, okay, well, let's get you in the office. Right. I mean, that's probably what,
Yeah, so I haven't done any yet. They're working on it, and I think in April is when we'll start.
You're gonna launch it?
It'll be an option for parents to schedule an online visit, and I'm looking forward to it.
So then do you just sit in front of?
Yeah,
like
I guess I think my iPad is how they're setting it up.
Okay.
Because it's got the camera on it, so they
Right.
can see me. My computer in my office doesn't have a camera, but yeah, I just be on my iPad and. We'll see how it goes, but I think for certain problems it will be great. But it's just kind of figuring out exactly what we can and cannot do. The biggest like people with sore throat. Is that going to be can you shine their camera in their throat and get a good look at their throat? I don't know.
Right.
Definitely can't look at their ears, can't listen to their lungs. But no, I'm looking forward to it. It's and we do a lot of phone medicine too in peds, where parents will call. And I've given my text number out to a lot of my patients, so they just text me directly.
Right.
And then we end up calling, talking on the phone. And with peds, you can rule out a lot of things over the phone and do a lot of triaging
Right.
and say, you probably don't need to come in.
Right.
And just give them advice. So, yeah, we've always done a little telemedicine that way, too. And parents do text me rashes all the time.
Do they?
Yeah, which, for kids, you can look at a rash and usually get a decent idea.
Oh, you can?
Well,
So
they don't have the
pretty,
fur cover.
right, exactly.
So you can see the skin pretty well. But, yeah, a lot of times, the picture they take is pretty good for kids.
Yeah, especially now with the iPhones. You
Oh, yeah.
can zoom in
Yeah.
and, you can see some pretty decent stuff.
Yeah, but I'm looking forward to the future of medicine. I just think the telemedicine, also just the artificial intelligence. It's my wife, Stacy's in informatics now, so she's doing research down at IU for their informatics department for pediatrics. But that's one thing I think they're working on is the artificial intelligence is putting in the data, and then the computer gives you an idea of diagnosis.
Right.
I think eventually it's going to get to that. Where,
Yeah, I think that'll be the big disruptor. I think.
Yeah,
as they start to, and not just there. I think in other things too, they'll be able to. That'll be kind of the crutch that people lean on. Yeah. And I think that I think that it's going to revolutionize. I mean, I've thought about applications even in veterinary medicine, from derm or whatever, where you could take that and put that in there and basically create a DVM within a few weeks. That could diagnose and say it's probably one of these two things.
Yeah.
In terms of,
Yeah.
Well, I mean, like Banfield operates that way right now. I mean, where you have to put in your symptoms, and then it spits out. That's that's a corporate organization. But they don't let you differ from what they tell you. So, like as a practicing veterinarian, they're pretty rigid in terms of, like if you put in your symptoms and it's telling you, okay, you need to be doing these things, and they don't want you deferring or going away from what they're saying.
Really? Okay.
Which is like that's where it gets a bad taste in everybody's mouth, about, well, you're telling me how I should practice medicine.
Yeah.
You're not in front of the patient, kind of a thing. And so, those guys have come up with that kind of system, if you will, for
and I think I would just, being a non-DVM, I would look at that and say, what's your level of confidence? I mean, if your AI gets up to 99.9, you know what I mean, you have that 0.01 that could differ. I think if you could get to that, then you can make an argument that, you know what I mean, from a diagnostic standpoint, that they're right pretty much all the time.
Yeah.
And it's probably that system just isn't that they've got. I mean, I would think that you'd have limited applications to start, within these fields or whatever, and then see what that level of competence is. But as that gets greater, like you're talking about in human medicine, I mean, it'll trickle down to DVM. I mean, the veterinary field and everything else. I mean, not just that. I could think financial markets. You name it. I mean, you could have that. I mean, where you have an algorithm doing the thinking for you.
Exactly.
Basically.
Yeah, I got a feeling that's going to be. You come into your doctor's office, you get a checklist or a tablet, I guess, and you check the boxes, and it leads you down that algorithm, and eventually, tells you what it likely is.
Yeah.
And, I think we'll be there to confirm it. Well, maybe we'll still be there to confirm it. Maybe eventually the computers will do it all. I don't know.
Well, and I think from a disruptive standpoint, though, I think that's where you'll see potentially the need for fewer bodies doing the work.
Yeah.
I mean, I think that's where the disruptor is going to be felt most acutely, is that maybe you don't need as many specialists. I've read articles about even remote surgery, things like that, where you'd have to have a surgeon in each facility doing the surgery. And if you could do not AI surgery, but remote surgery, such that you could be doing a procedure in Alaska, but you're in Indiana, that kind of thing. I mean, I think just like I mean, medical people, I mean, 100 years ago couldn't imagine what we have today.
Oh, yeah.
I'm sure it'll be like that
Exactly,
50
yeah.
years from now.
Yeah.
Like, we can't possibly imagine the tech and the tools they'll have going forward. So,
What do you think for, like we were talking earlier before the podcast started about like Holden and potentially his interest in medicine. What do you think about medicine as a profession for people, young people like our kids' ages moving forward?
I would tell anyone that wants to go into medicine, make sure you're doing it for the right reasons. A lot of people, especially, it's probably not the same now, but when I was a kid in the small town Peru, the doctors were like, they're the professionals in town. They're the money maker. I just always thought this is a glamorous lifestyle doctors would have, and maybe back then in the 70s it was. But
Right.
if you're going to medicine, do it because you want to take care of patients. Don't do it because you want to make money or, we make good money, but you're not going to be wealthy being a doctor,
Right.
probably.
So if you're not passionate about it,
If you're not passionate about seeing patients and taking care of
Right.
patients, then you can find a lot of professions that make more money than doctors do.
right, right,
But if you really want to take care of patients, you really like people, you like being around people, I think it's great. It's just a lot of work, obviously, to get there.
right.
When I think the toughest thing with medicine is you don't really start working until you're 30. You're in training your whole life, and then you're 30, so you're 8 years behind everybody else as far as having a family and saving for retirement and all those things. But medicine's a great field. I don't know what's going to be like 20 years from now, just from what we're talking about.
Right.
But if you really love people, being around people, and want to help people, it's great.
And do you think the cost of education is a factor?
Oh yeah, it's
And
so
like
much.
them just right.
it's that sigh, oh boy.
Yeah,
Yes,
and that's
it
the
is.
problem. And if they don't figure out a way to, get education more reasonably, people will quit going into medicine.
So do you think do you have any idea what it costs right now for somebody going into college to become a doctor? Like what their education cost
I would
is?
bet probably 200,000 on the minimum.
That's
side
what we
of
were
things.
talking.
For med school alone?
Yeah. No,
Yeah.
for
Well,
med school alone or for undergraduate and med school?
Probably. Well, if you went through a state school, probably could do both for two. I don't know what the tuition is at IU med school now, but
Yeah, so your
probably minimum would be 200,000.
yeah, so like your return on investment then
Yeah.
by
That's
the time
tough.
Yeah.
right? I mean, that's why it's so. That's what we talk about in veterinary medicine. Aiden Walker's dad was asking me about
Oh,
because
really?
Aiden wants to go do large animal medicine.
Oh, really?
And,
Okay.
And I was like, oh dear Lord. I mean, like you're not going to make any money,
Yeah.
as a large animal vet, and then you're trying to pay back. If you can go and it doesn't cost you anything, okay, sure. Yeah, consider it. But our vet school tuitions are like up to 160, 180, 160, 180,000. And I'm like, for
Out of
what
state's
you
200.
get and that's what?
Out of state's 200.
Yeah. And for what you get from a salary standpoint when you graduate, I mean, like, how do you make ends?
Yeah,
You know what I mean?
yeah.
Like, it doesn't make sense,
Yeah.
I've said this 1,000 times, is that wages haven't kept up with the cost, the barriers to entry for the field. So whereas wages years ago, say, were 40 grand and it cost you 36 to go, total out the door, 8 grand a year. I mean, now it's grown to become a veterinarian has grown by about 5x, but the wages have only maybe say doubled.
Oh, really? Okay.
So I mean, that's the problem that you look at. You go, okay, you look at that from an ROI standpoint and say, okay, I got to borrow 200 grand, but my wages are going to be capped at about here. So how long does it take me to pay that back? I mean, that I've entered this field or whatever. I don't know,
Yeah.
whatever calculus you go into. And I think that's the tough part is that people can do the math and they'll say, okay, I can do this, or I can go to this field, even though I really want to do this because the numbers just aren't there.
Yeah.
So it's tough. It's a challenge for the field, and I think that's something they're going to have to address going forward.
Yeah.
And I don't know how
and
they're
you
do
feel
it.
like that in human medicine too, like where
Well, I think for primary care medicine, definitely.
Yeah.
I think some of the specialties, especially that do a lot of procedures, they've always been the ones making a lot of money. But for primary care,
right.
so I don't know what the solution is for human medicine, what they're going to do, but definitely it's hard to build up that much debt in undergrad and med school and have to pay it off. Luckily, I got that scholarship from the state, so that paid all my tuition in med school, so I didn't never had that issue. It's getting people into primary care is going to be hard for the med schools going forward because it's a lot of work to get there, and then you don't have the payoff at the end. And,
do you think you're going to see more like nurse practitioners?
Oh, yeah,
or
definitely.
more like
definitely the
physician
nurse
assistants?
practitioner, physicians, PAs, NPs and PAs are huge right now. And a lot of, I think that's where it's going in primary care, is that you'll have one doctor managing or working with five or six extenders basically. And so I think the role of the primary care physician, unfortunately, is going to probably go away in the next 15, 20 years.
Because then you're basically helping, like if they can't figure something out.
Yeah, exactly.
Or
You're
if
there
they
to
need,
help them.
Right. Yeah, interesting. So you're not even, would potentially not even be in front of patients.
Well, yeah, there are a lot of clinics now that just have a nurse practitioner, and then they have a doctor that they can consult with either over the phone or whatever. So yeah, that's by the time it gets to that point, I'll be retired. This is my last. I've got another 15, 20 years probably, hopefully. But I don't know. Medicine, it's a rewarding job, but it's not an easy job.
Right.
And if you can, unfortunately, there's a lot of. Being at Garen Catholic with the kids or with Daniel, they're just meeting everyone and what they do. It's just kind of opened my eyes that there's a lot of careers out there that are very lucrative, and I'm not in one of them.
Right, right.
It's just kind of fun. I always tell the joke that I'm a doctor, but I'm one of the we're one of the poor families at Garen Catholic. I just always joke about that. But,
yeah, exactly.
I do feel that way at times.
No,
I think we all feel like that.
Yes, exactly. I think we all feel that way.
It's like, what do you do for a living? Holy smokes!
Yeah.
Well, I always ask Daniel,
not
or he'll always say it's finances. They're in the financial world. I'm like, oh, what's that mean? He's like, I don't know.
I don't know.
It's, finances.
Yeah, exactly. They're managing someone else's money.
I was in the financial world. They're doing something I wasn't. Something else.
Oh gosh, yeah, that's too funny. You mentioned that. Okay, so before we close, I have to ask you about COVID-19 because I'm sure my mother's listening. Okay, so no, but in all seriousness, so do you as a physician worry about those kinds of things, like personally, like when you're exposed to those types of news stories? Like I'm not a poo-pooer, but I'm like, okay, this is the normal, typical, like, writing out of this scenario, like what's more likely to occur. And then therefore, nobody needs to panic, but you also should be diligent.
Exactly.
So are you in that boat? Like where,
So I'm not worried personally about myself at all.
Right.
I'm fairly healthy, 48-year-old man. I'm probably going to be fine if I get it. The biggest concern I have, which is just the healthcare system in general, is going to get overwhelmed if this hits like they're expecting it to hit.
Right.
So
you mean like the hospitals?
Yeah, they're going to go
places
over
like that.
the hospitals and the adult. The good thing is right now kids aren't getting sick with it, at least what they're reporting. So for me, it shouldn't change what I do a whole lot. Plus, I just do outpatient medicine, so I'm not doing inpatient pediatrics. But the biggest concern for me is just what's going to happen when you have more ICU patients than you have beds.
Right.
And I think that's the biggest thing, just from a public health standpoint, is how are we going to manage if this hits like they expect, all these older people that need to be in the hospital.
So so everyone's out, like, bought hand sanitizer. There's no hand
There's
sanitizer.
none anywhere.
At the airport, they were like had been out.
And so everybody's buying hand sanitizer, which I get. Maybe it's an alternative to hand washing, right? But I mean, I don't know. It seems like it's like.
Well, we
so
read
extreme.
We were at the airport yesterday, flying back, and we had like an hour before we got on the plane. So I was looking at, I read articles, and I came across a few, and it's interesting because once you start to read these articles from qualified people, epidemiologists, you start to say, oh, okay, it's not exactly this thing that they're making it out in the media necessarily. And I thought that was interesting because they were talking about the populations that were truly at risk, and how the media sometimes will make it like everybody, if you get it, you're done. But it wasn't. I mean, once you get into the nuance, it wasn't quite like that, which kind of negated some of the things that people are telling. You should always be diligent, to your point. I mean, wash your hands, things like that. But it wasn't. It was a little bit more nuanced than it's being made out to be in the media.
So how was your flight? Was it full or?
It was full.
Yeah, the flight was full. Yeah, I mean, there's, I mean, I think that everybody, I don't know. I mean,
people were coughing. They were spraying.
Get
out. That was good.
No, I think it's just fascinating to watch human nature.
Yeah.
When posed with a
because you have to be around people, just like on the plane. You're around 150 people there, back. You go out to dinner. I mean, it's almost impossible.
One of the girls here at work today was telling me that Dr. Dudley was saying her husband used to work for Avon, and they shut down the school for 2 weeks.
Yeah, I saw that. Yeah.
You know, so I'm like, oh wow, okay, my kid can't be home for 2 weeks.
Nope.
I'm like, what are we gonna do if our kids are home trying to do E-days? Calvin doing E-days.
No thanks.
Yeah, no thanks.
I will draw him.
I had to laugh when you were, I know, right? I had to laugh when you were like, yeah, the kids come in and they say the funniest things, because this weekend, Calvin, we got a letter from Mrs. Algram.
I got a
An
couple
email
letters.
from Mrs. Algram saying Calvin, you know, was acting up in class, and she said he sent a note to his student sitting next to him, and it said he tore off a piece of his social studies paper he was working on, so it's a corner piece, like only this big, and it says, "We are not friends."
No, it said we're not friends. And we were, you know, we were glass half full, going, "Hey, the contraction's right," and he spelled friends correctly.
And he spelled friends correctly. Okay,
That's
we're
good.
doing okay.
And
Yeah.
let's face it, there's other friends. So come on.
No, it was hilarious because I was like, oh, that just reminded me of that story. It's kids are funny.
So what part of Florida were you in recently?
Bonita Springs, so like Fort Myers.
Okay. So how were the crowds there? Were people still going out to eat? And
Oh,
Yeah, I mean, people are still going out to eat. I think that, you know, like our parents, like my parents' concern, because they're older, they're over 75, you know, is, you know, if we get it, we can't take, you know, it's harder on us if we get it, which of course is
Definitely,
true, you know, and so, you know, the nursing homes, of course, you know, and you have such a large, in America, such a large population of people over 70.
Oh yeah.
Right.
And so I think that's where the concern is. And that's what they're talking about on the local news and things like that. You know, but it's just,
Scared everybody half to death. I mean, you know, it's serious, but it's interesting because, I mean, I was thinking about years ago. I remember I was doing insurance claims, and it came over the radio that a hurricane had changed course, and literally in 5 minutes there were 10 people in line to get gas. It was just this mass thing, and I'm sure that's the way it is in some of those places, because you know, you do think, oh no, we have to react to whatever's coming down the pike. So whenever you have the first case in an area, and certainly the fatalities, which are always serious, I mean, they react that way, you know. So, and I get it.
Well, I think it gives people a sense that they're in control of something.
Right.
Of course. If they can go buy a bunch
Absolutely.
of water or toilet paper or hand sanitizer, at least they're doing something.
Right.
Even though it's not going to help. And you don't need to do anything, but it just gives you something that at least you're in control to some degree.
Absolutely.
And everybody's just scared that,
No, I get that.
what is this? And, you know, I've done a lot of reading just because we're going on a cruise, supposed to be going on a cruise, and we're not going to. But so I'm just kind of keeping up with, you know, what's going to happen with the cruise industry, with the travel industry. Are they going to shut everything down?
Yeah, I mean, it's so
Short the
fascinating.
stocks.
Yeah, because they're just little isolated pools of
Yeah.
stuff, you know, and if no one's going to let them dock, like we were talking about before, I mean, like, what are they supposed to do, these poor,
Well,
I
that's
don't
that's
know.
what's interesting, because I mean, we talk about, like I was saying, I read those articles, and they're trying to make it more of a nuanced kind of conclusion. But then you see these public actions being taken by governments or cruise ships. You go, okay, wait a minute. This person's saying it's not that serious, but they've kind of walled off the city in China. So what's really going on? So that's, I think, the disconnect kind of in information and what you're getting, and it's tough to make sense of what the truth is. You know.
Well, I think we'll have better information in the next 2 to 3 weeks as
Right.
we are testing more Americans, you know, with milder illness.
Right.
That's the problem is right now the people initially are getting tested were the really, really sick.
Right.
And there's probably a lot of people out there with mild illness that we don't know about.
That we don't know
So I
about.
think that, you know, the death rate will go down, and we'll see a lot of people with, you know, minimal illness. But
it was funny. Betsy, or Emily's sister, when we were in Florida, was telling us a story about her son who has a job. He lives in Singapore, and he happened to be with his daughter for a bit, and they're testing. I guess whenever you go into a public place, they're testing.
whenever you leave, whenever you come into a
yeah,
public
they're
place,
testing your
temperatures.
temp, you know. And it was funny because he was locked out of his apartment building. He didn't have the key fob to get in because his wife was out doing something. And so he's like, well, we'll go see a movie. So he's carrying his daughter around, and he goes to go into this movie theater, and they take his temp. He goes, you can't come in, because he was huffing and puffing his daughter. It's like, you can't go in. He's like, darn it. So some of those places are really, I mean, they're very, very serious.
Every time they get on the subway, every time
Yeah.
they go into the apartment, but they're just like, he's like, I've never been more aware of my body temperature.
so then what do they do if they have a temperature? Do they
You can't go in.
you just can't go in, but they don't make you go see a doctor?
I don't know.
That'd
I've
be-
never asked that question because
The
they
story
haven't
ended
had
with he
temperatures.
couldn't get in.
Yes,
get in.
exactly. Good story. Well, and you know, his company Epic is who he works for.
Oh, yeah.
And so there's a population of them in Singapore because the Singapore government hired them to do their records. So then they had to separate them out because they have people going in and out of the hospitals, and then people
right.
working on the computer software, and so they cannot interact. They can't commingle socially or at work. So they've separated them into two groups.
Which is, that's the
Which is
disconnect.
kind of like,
It's
wow,
weird.
okay.
Yeah.
That's like really rigid, like, you know
But
what
is
I
it-
mean, like control. But maybe
Right.
they feel like in those scenarios,
The really population dense areas, you think that's what it is? Maybe they're saying you're going to have contact.
I don't
I don't
know.
know. It's weird. Maybe the spread's greater. Who knows? I don't know.
So
interesting.
maybe it's another thing of making them feel like they're in control,
There
you know,
go.
of the
Right.
scenario. Maybe.
Yeah, of course.
But they couldn't go back to Singapore for a while. They came home for a wedding, and then they were stuck here, and so they couldn't get back into the country. I think it was maybe 10 days they were stuck here.
Oh, really?
You know, before they could get back into
Yeah,
the
per
country.
their company. I don't think Epic would let them go back, would
Right.
they? Yeah.
Yeah. So
So, yeah, it's interesting.
fascinating.
So,
Yeah. So okay. So before we end the podcast, one of the questions, Richie, you want to ask because I always mess up.
if you could go back and have a conversation with your 20-year-old self, what would you tell them?
Oh, what would I tell myself 28 years ago, I guess? Wow.
Don't go to that. Don't go to that party with Fred.
I guess if I had to tell myself knowing what I know now is one, just enjoy life more. That's one thing I didn't do in my 20s because I was going to med school.
Right.
I missed out on a lot of things that I think my other friends did. And I don't know if I could have done it and still gone through med school or made it through med school, but just the traveling,
Sure.
the just doing things that you can only do before you're married, I guess.
Right.
As far as just taking off for a week or two
Right.
and just traveling the world. That's probably the biggest thing I regret is I didn't. Well, I guess I didn't have the opportunity to do that when I was in my 20s, but I wish I did.
Yeah.
And that's why
if you did, you would say do it.
Well, yeah. The problem is when you're 20, you don't have any money to do anything.
Right.
You're broke.
Especially when you're in med school, you don't have any money. And that's why I guess I'm going to encourage my kids to do is, see the world when you're young, at least to some degree. Don't worry about making money when you're young.
Mm-hmm.
Life's long. Enjoy it. But I think that's the biggest thing I wish I would have done is maybe delayed med school by a few years and
Right.
actually had a job, made some money, traveled more, enjoyed my 20s more, I guess.
Right.
Because looking back, med school's hard. Residency was miserable. In residency, you're working constantly. And I didn't have enjoyable times in my 20s.
Yeah.
So that's the regret I have in my life. But I probably wouldn't be a doctor if I did enjoy my 20s more. So
Right.
I maybe who knows what I'd be doing, but I'm going to encourage my kids to we're in a different situation as a family where I can take my kids traveling when they're in college or out of college. We can go on a trip. Whereas I didn't come from a family that we could do that.
Right.
My parents weren't taking me on cruises and stuff like that when I was in high school and college. So I think their lives will be different than mine just from that aspect.
Sure.
They won't have to be struggling for money, I guess, when they're in their early 20s. But yeah, that's the biggest thing I would regret in my life is just not enjoying those times. Did you go right from undergrad to vet school?
Yeah. Yeah, I went right from I spent the summer in at college because after I graduated taking physics because they wouldn't take me if I didn't have physics.
Oh, really?
And so I stayed to do physics, and then that August went straight to vet school.
So when was Harrison born compared to that time?
Harrison was born
The following August.
the following, like when I got out of vet school.
No. You were out. He was born. Harrison, you got out of vet school summer of 96. He was born the following
Spring of 97.
We got married. She graduated May of 96. We were married December 95. So Harrison was born March of 97.
Yeah.
So then when you finished vet school, did you start working here or did you?
No, I worked at a practice in South Bend.
Okay, and you coached basketball up there, right?
Yeah.
Okay.
Mhm. Yeah, so I worked in a practice up in South Bend for 5 years, and then we moved back this direction.
2001.
Yep. And then I worked at Broad Ripple Animal Clinic for a couple of years and then started our own practice.
Okay.
So, yeah. It's been a
Been here ever since.
long journey. It's been a good journey. Yes. So
It's funny how things you look back and you go, that was pretty quick, but at the time it didn't seem quick.
it didn't seem
Oh,
like
no,
it.
it's
Right.
Yeah.
It's like because you think 96 to 01, really just barely 01. I think we moved here in March of 01. That seemed like such a long period of time.
Oh, yeah.
But then you go 01 to May of 03 felt like a long time. But then even looking back from 03 to today feels like you have to remind yourself it's been almost 17 years.
Yeah.
It's like, wow, but it's gone by so quickly. So
Yeah. That's, I guess, I think I would tell my 20, enjoy the kids when they're young. That's
Sure.
And that's part of my job too. That's Stacy. We still get in arguments about how little I was around when they were young,
Right.
which is true, but just missing out on a lot of the, normal kid stuff. Changing diapers and taking them to their preschool stuff. I missed a lot of that stuff too.
Oh yeah.
The music
Music
performances,
recitals and everything.
And, 'cause it seemed like OLG always had those on Wednesdays, which is my night on call. So I missed a lot of the recitals and other stuff. So I guess if I look back, say, you can work your whole life, but you only have kids for a short part. So
that's the interesting thing, I think. And we all go through this. Certainly when I was in college, grad school, to succeed, you're on that path to success. But sometimes, to your point, I think you do have to step back a bit and say, the balance that goes with everything. So
I just wish I would have taken a year off between undergrad and med school. Just take a year off and traveled. I didn't have the finances to do it,
but those memories, though, I think that's big. I think like you say, your working life, like even 25 to 6, 30 years. So a year is nothing when compared to that, but the experience.
I think though that our generation, that's what you did. You put your nose down and you worked and you killed yourself until you got it done. And that's, it's like, I'm just going until I can get it. You know what I mean? Like you don't even think about smelling the roses, kind of a thing. And, now Harrison's generation has a much better, feeling of that, sometimes it's frustrating
balance.
Because I'm thinking just, why, so, it's different, the generations and how they see things or view things.
I didn't know anybody in undergrad that took time off. Everybody in the business school, you were almost considered less than if you did not have a job at graduation. I remember talking to you, going through campus recruiting and stuff, and everybody had employment somewhere, somehow. You were working within your designated field, and almost everybody basically graduated in May and started a week or two later. That's what I did and what everybody did. So,
but you're right. Looking back on all of those hours and all the time and, having to pick, potentially your clients over your family, in order to get where you needed to be. Is hard. It's a hard thing to live with, and so I think that's the same thing. I would say the same thing,
sure.
And so I was constantly calling him going, tell me when they do this, do this, tell them, because you feel like you miss everything. And that's why poor Harrison and Madeline with my grandkids, I'm going to be like,
is your mother here again? She really doesn't have to come.
Oh gosh, yeah.
Just
so
kidding.
Anyway, well, listen, we want to thank you for being on the podcast with us today. If people want to get a hold of you, where can they find you?
The best place is the IU Health website. If you or probably Google, honestly, Google Richard Keller Cicero. That will bring up the IU Health website, and then from there you can actually schedule from the website.
Okay.
So new patients can schedule. Existing patients, it's very easy to schedule online now, which I love.
Yeah.
You guys have that for your
I
office?
did that. Yeah, we do. We do an app called Vitus Vet, which is you can do all your online scheduling and everything.
Yeah.
I used it for my own doctor's appointment. I used an online scheduling.
Yeah, the one we use is called ZocDoc, Z-O-C.
Yeah, that's what I used.
Which is great.
Yeah, I liked it a lot.
So, yeah, it's for ZocDoc, if you just put my name in, Richard Keller, it'll bring it up. Or IU Health Physicians website, or Google is the best way. I think my office number is, I'm not sure what it is. 985-3162 is my office number in Cicero. But we're right on 19 in Cicero. Very easy to get in and out. There's no traffic there. And the biggest thing I've understood or come to realize is no one knows where Cicero is that lives in Noblesville, Westfield, or Carmel. So Cicero is just north of Noblesville, about 5 miles from downtown Noblesville on Highway 19. Nice lakeside community, very easy to get to, very easy to get in and out of. We have great parking. And again, I have accessibility pretty much all the time. You can probably get an appointment within 10 minutes if you need one that quickly.
That's awesome.
And we actually have walk-in appointments available too, where I just saw one today. Kid threw up at daycare, and Dad picked him up, came by
to you,
I saw him immediately. So
that's awesome.
no wait or anything. So yeah, but it's growing practice. Hopefully we'll do well, and it's fun to be in the community and practicing here. So.
Well, that's awesome. And we'll put a link at the bottom, right, Harrison, after the Facebook thing that'll take them. They can click on it and take them to there too.
Oh, that'd be great. So.
But yeah, thank you very much. Do you want to?
Thanks for having me.
Yeah, of course. Harrison, put that down right next to you.
There you go.
This is a thank you.
Appreciation.
Yeah, thank you.
Well, thank you
there's
very
some
much.
cool socks in there for you.
Awesome.
So
Thank
yeah,
you.
and everybody, don't forget to check out the merch store, asbcmerch.com. You can see now we're coming into spring. Hopefully the weather stays
Hopefully
above
you
50
won't
degrees.
need those, but if you do,
You'll
get
know where to
one.
find them. And then our cool long sleeve shirts and the onesies for the little ones. So, all right, everybody, we'll see you next time. I'm Dr. King.
I'm Richie King.
And
I'm Dr. Keller.
we'll see you next Monday. All right, thanks everybody. Have a good day.